Hi, everyone, and welcome to another edition of New Jersey Nursing Insights podcast. I'm Sue Weaver, and with me is my co-host, Daria Wazek.
We're your new co-hosts from the New Jersey Collaborating Center for Nursing, and we're excited to get right to it. The state of healthcare right now is tough. That nursing shortage we're all living through, it definitely does not spark joy.
Exactly. And we can stew in that for a while, but we can't live in it forever. So on this podcast, we're going to hear from a nurse who's leading research to advance the success of our nurse leaders across the country, which brings us to today's topic, digital competencies and digital communication. We communicate every day, particularly on social media, and I don't think anyone would deny that being able to master communication is important for effective leadership. The tools we use to communicate have been changing at a fast pace. It's hard to keep up with technology, even for us early adopters. But what are the lasting skills and competencies nurse leaders should have related to digital communications?
Today, we are chatting with a nurse who has published digital communications competencies for nurse leaders, which are now being incorporated into the American Organization of Nurse Leaders Competencies.
Dr. Alysia Adams is the Director of Education Partnerships for the American Organization of Nurse Leaders. Dr. Adams, welcome, and please take a moment to introduce yourself.
Hi, thank you so much for having me on your podcast. I enjoy getting to talk with other nursing leaders who are leading great work. So thank you again for the invite. My name is Alysia Adams, like you shared. Currently, I work for the American Organization of Nursing Leadership, where I have the great honor and privilege of bringing our programs into institutions and partnering with other nurse leaders across the country to lead leadership development and whatever the nurses need in their area of expertise. So that is my day job. In my dream life, I do research on digital communication, which is what I would consider the thing I do for fun. So I really enjoy figuring out kind of how we can leverage our collective nursing voice and our collective nursing power. And I think digital communication is the way of the future as we move into the digital era of nursing leadership.
So what prompted you to get involved with digital communication? What's your story behind that?
Sure. So, just to preface, I started as a nursing leader fairly early in my career. So I was in my mid-20s, took my first leadership role. And I would say that was at the bedside, right, as a charge nurse. And you're always looking for ways that you can partner with staff, with the people that you're supporting. You're always looking for ways that you can maybe convince them into picking up an extra shift or two. So I think my partnership with communication began then, right, very early on. And as my leadership evolved, I realized, like, okay, we have to figure out better ways to communicate. Communication is kind of that crutch that is, if we do it well, we bring people in, we create supportive environments, we lead change. If we don't do it well, we create barriers, right? We have challenges to communication and how we are able to do patient care, how we're able to grow others. So with that is kind of how I got to the point of being passionate about digital communication and how we bridge communication gaps in healthcare.
Wow, very interesting how you got started. And we saw your article in Nurse Leader, and it's titled Reimagining Communication in the Digital Era of Nursing Leadership, a Delphi study. And I think it's a great roadmap. You tested and finalized 9 digital competencies. So tell us how you did that and maybe explain about the Delphi study that you did.
Sure. So we've started the process of determining what are the barriers, right, for digital communication in nursing leadership. And I think I just like to share, there's lots of research out there on how nurses in general use social media, how they find jobs, how they research leaders that they're going to work with. So there's lots of evidence out there, lots of things on how nurses in general are using digital platforms, but there's not a focus on the specific population of nursing leadership. And what I had noticed just in like a general assessment is that there's a big gap, right? Like we might use LinkedIn, for instance, to share stories or posts, thought leadership, that kind of thing, but not necessarily leveraging it across all facets where we can have influence in the patient care setting, where we can have influence over staff, where we can use it to leverage our collective voice inside the healthcare system as well as outside. So that prompted me to figure out, like, well, are there barriers that exist to nursing leaders being part of the digital communication sector? And of course, I don't think what I found was something that would be unbeknownst to anyone. We're a risk-adverse profession by nature. So by nature, what I found was the barrier was that we were scared that things were risky and we didn't really want to partake because we didn't know if we were going to get in trouble personally, if someone was going to do something that maybe would be perceived as inappropriate, or we see that all the time, right? Like people get on TikTok and they do things and it's not necessarily painting themselves or their workplace or profession in the best light. And so because of that, I have to quote my colleague, Dan Weberg, we stopped the 99% for the 1% problem. So with that research, I was like, okay, so we've identified, like, here's some barriers. And then I realized when I looked through all of the qualitative components of the study and the comments that people were sharing about maybe why they had abstained from use or why they use personal but not professional, why they use it with staff or students or don't use it with staff or students, that we hadn't really called out and developed what is it that nursing leaders need to know in order to be effective in this space, right? Like, how do you even have effective digital communication if you don't know what do you need to know about it? There were lots of questions, right? Like, I don't know how to use the platform. I don't know what I'm supposed to share, what I'm supposed to do. So that led to the digital communication competencies. And how do we determine what is the knowledge? What are the things that we should focus on if we're going to lead in the digital era of nursing leadership? So that's how I got to the competencies. So I think that'll gives you the lay of the land of how we got there. As far as the Delphi study itself, so I'll be the first to share my background. I have a DNP in nursing leadership. So formidable research may not always be my strong suit, but I am good at collaborating, as any nurse is. So I always like to bring in some partners, which is what I did in this case. Had a great partner with my colleague Rachel, who we just kind of gathered some mentors to help us determine what would be the best way to vet the types of competencies that we feel like nursing leaders need. So we started with what we had found from the qualitative work from the survey, and kind of outlined and put them in a thematic analysis, determine, like, okay, these are the things that we determine these leaders need. And then from that, we went and walked the Delphi study process. So we did 2 rounds of surveys with people who would be considered experts in digital communication. And they really helped us to review and refine the competencies. And so from there, we started with 7 and we ended up with 9 because we determined that there were a few things that needed to be separated out, really needed to be called out, especially the digital inclusivity piece. I think that was huge for me whenever I was looking through all of the information that we had gathered through the Delphi rounds, that we hadn't necessarily segmented that you need to make sure what you share is inclusive for all people, that people read or listen or hear differently. And I almost was like, oh my gosh, like, I'm a nurse, of course, like, we have translators, we have various different components I didn't even think about maybe I need to use alt text or I need to approve that other languages can translate what I'm sharing. So just things like that. I thought, that was really exciting to see people thinking through all of those things when it comes to the way that our communication has evolved over time.
Well, thanks, Alysia. And I think you explained the Delphi study really clearly in the article. It was really easy to understand. And I especially liked after the focus groups, how you outlined in table 1, the original competency and then the final competency. You could really see the value of having those focus groups with that change. So that was great. Can you describe a competency or two to just talk about specifically?
Okay, so I have to start with my favorite, which is content creation and storytelling. So I think by nature, nurses are storytellers, right? But I think we've had challenges over the years in what stories do we share? How do we share stories? How do we bring people into our work? We always say, oh, well, they're not a nurse, they're not going to understand. And I think the storytelling piece of our competency and our duty as leaders is to really lead the narrative. So what do we share? What are we not sharing? How do we identify how to bring people into the story of nursing and into the care environment, into the various different ways that we affect our healthcare system, not just, locally, but also at the state, national, and global level. Nurses have a lot of power of influence, and I think the storytelling competency is really how we leverage that collective voice. So I'd be remiss if I didn't captivate what that means. And I think that can be looked at in so many different ways, right? Like we have what I would consider nurse influencers, and they're all different types, right? Some who tell jokes, some who provide, just thought leadership engagement, some who talk about, some of the raw, uncut pieces of healthcare and what we're facing as a profession. I think collectively we need to leverage all of those, but we also need to make sure that as we're sharing our stories, we don't want them to, we don't want to have the two extremes, right? The toxic positive part or the extremely negative part. Like we want to make sure that we're sharing and storytelling things that bring people into what is the real world that we're facing. So I think that's probably my favorite competency if I had to pick. If I was going to pick the second thing, I think nurse leaders specifically have challenges with boundary setting. So the digital communication and boundaries for nurse leader well-being would probably be my second favorite to focus on. And I think that's because I always talk about it in terms of the nurse leader magic trick, right? So like, how do you give yourself time, but also how do you maybe put yourself in more than one place at one time? And I think if we leverage our digital communication tools effectively, you can literally be a magician. You can pop up and be everywhere, right? So you can have your face, say hello to the new staff member who started on night shift, and you can be at your kid's soccer game, or you can be on vacation and you can schedule posts to share things that are going to impact patient care quality, or things that, there's a policy that's being submitted at the federal level, and you want to be able to share like why nurses need to submit comment or something like that. You can schedule those posts out and still be part of it, but not necessarily have to give that time when you want to give that time somewhere else, or you want to be fully present somewhere else. So I love the nurse leader magic trick for that reason.
These competencies will be so useful to inform curricula to ensure the next nurse leaders will be better prepared to effectively communicate once they graduate and get out to practice. And let's face it, many of our new nurses progress to nurse leader roles very quickly. They may not have the ideal preparation. So thinking about that, and maybe it's the same two competencies, but which of these competencies are the biggest opportunities where our nurse leaders can grow, do you think? Where are the biggest gaps right now?
Oh my gosh. So I want to share about generational leadership. So when we think about nursing and we think about our younger nurse leaders coming in and needing to lead, they're leading cross-generationally. But I also think about that for our, senior nurse leaders, our senior executives, those types of things. We're also supporting different generations. So I had a great colleague of mine, Erin, who shared about the Mickey Mouse Clubhouse, and I've since translated that into my own presentations because I love it so much, and it shares with us how things evolve over time, right? But how something so iconic like Mickey Mouse Clubhouse has changed how it projects to each generation over time. And I think that's one of the things that we have a gap with in nursing leadership, right? Like we have to evolve, and it's so hard, right? When we get set in our ways. But, if you're of the baby boomer generation, you have to evolve your communication style to network and build community with the Gen Z population that's entering the workplace that you are tasked with leading, right? If you are a Gen Z nurse leader and you're in charge on the unit and you are taking care of, say, a silent generation patient, you have to evolve your communication style to understand that they need you to come in the room and have a conversation with them. They're not looking at an app on their phone. So you have to evolve both ways, right? So I think networking and community building would probably be my biggest need right now if I were going to select one. And then I always think of, nursing is, we haven't always been ingrained in the numbers, right? So not necessarily just financial, but how do we evolve our quality metrics? How are we bringing ourselves into all of those things? And so measuring the digital impact would probably be my second. I think we always have to we're tasked nowadays with creating a business case for things, with showing how they have an impact in our systems. So I always challenge nurse leaders at any level to how can you tie these things back? So looking at how can you leverage your survey data? How can you show your quality metrics are improved by maybe that you effectively built community in your department and you were able to reduce your turnover, so you're able to increase the quality of patient care that you're providing on the unit. But looking at, if you're choosing to maybe have a YouTube channel that's private for your department, and you're going to share something, how has that affected what your goal was? So making sure that you're setting goals to tie back to that. I think those are the two things that I see as gaps right now for nurse leaders when it comes to us entering that digital era of nursing leadership.
Thank you, Alysia. You mentioned earlier the nurse leader's role in storytelling. And my thoughts are a lot of nurse leaders might not realize the value of storytelling. And can you speak a little more about that? And what is the nurse leader's role in storytelling? And how is that different in the digital realm compared to just speaking verbally?
Okay, so when I think about storytelling, oh gosh, there's so many things that come into play. So I think about trust, right? So nursing has long been listed as the most trusting profession. And I think when we tell our stories, we build trust. And that's multifaceted, right? So I'm going to talk about it from like an interview perspective. If I am, say I'm looking for a job and I've gotten a call from the recruiter that I'm going to interview on X public health institution, right? I'm going to interview for a position as a community nurse leader, and I'm going to be working for, I'm going to just use Florida Department of Health. I am going to look for the person who is going to be leading me, right? I'm going to look for you online. I'm going to see, what are you talking about? What are you sharing? How do our values align? How do your values align with what the department is that you're working for? Like, what does this look like? And where do I fit into that? And I think I share that to share, like, oftentimes we forget to be honest, right? And to align our personal with our professional so that we don't have misalignment and build mistrust. And I think there's a lot to be said for how you can leverage that in your storytelling, especially when it comes to the digital space. Like, what does your profile say about you? Is your picture out of date? Is your profile picture out of date? So when I meet you for the first time, am I going to be like, oh, whoa, you're not the person that I expected to see? So I think just being able to align those things and create that synergy is really a big part of our storytelling picture. But I love to share it in terms of when people are looking for you, people are intentionally looking for you and they're looking to partner with you or work with you. How does what you share, how does your visibility online, what does it tell them? Because that speaks for you before your introduction, your first meet ever will. So that's really their first impression of you nowadays.
So I'd like to follow up on that, Alysia. I've encountered some nurse leaders tell me, well, I'm not on social media. So what is your reaction when you search for somebody and there's nothing?
Oh my gosh. Well, I'm going to have to pivot to my 4-year-old who at dinner last night gave me the shocked selfie. So I think I would be like, I'm pretty shocked about that. I share all the time, like you really want to have a profile and have a presence because people are going to intentionally look for you, right? So even if you're not necessarily sharing a lot of things, like at least so they know, they can see who you are, right? Where you're at, where you work, a little brief, intro of who you are, how long you've been a leader, something on there. But it really does build that first interaction. I always share that people cannot follow a leader they cannot find. So if they don't see you online and they don't necessarily see you, in the halls, or they don't necessarily see you because you work remote or whatever the case may be, it's going to be hard for them to follow your lead. So you have to be present somewhere. And I think the digital space really gives us that ability to have that visibility and presence and connection, which is why I think you have to kind of look at the competencies as like one feeds into the other. But it is very hard for people to follow someone and engage with someone that they cannot find.
Yes, I agree. I always wonder when I can't find somebody, I'm like, why can't I find this person on LinkedIn at least?
I always jokingly say maybe they're in the witness protection. I don't know.
So, Alysia, I have personally observed circumstances where leaders will hire communications experts to handle their social media or other digital communications. But then they find it tough to delegate it because those individuals just kind of lack the knowledge about nursing. Do you think nurses can enter the communication space as a specialty to fill this void?
Oh my gosh, I hope that they will. So I look forward to the day. I see lots of nurses who are engaging in media opportunities, who are doing things like you guys are doing, right? Like running podcasts. Like I think that's a great leverage for our digital communication tools. So absolutely, I think that there are going to be more nurses who should enter that PR space, especially as it comes from kind of collaborating with marketing departments and risk departments and various different aspects of that. I think one of the things when I think about leveraging communication skills, using consultants and things like that, the tools offer things, right? Like scheduling modalities, they offer various things. So I think you can only delegate so far, right? So you can delegate to get things up where they're scheduled for 2 weeks and you have a little bit of time to review them and make sure they're aligned with your voice. So I think there's ways that you can do that, but I think you have to go back to how does it align? What is the brand that you're looking to project? What is the voice that you're looking to project? And just making sure that there's alignment and synergy of those things and how you want to be represented. What is it that you want people to find when they go looking for you? But I definitely think there's a space for nurses to really leverage the collective voice. I think we're seeing that with, a lot of the blogs and the content writers and various things like that are a lot more popular over the last 5 to 6 years. A lot more nursing podcasts. We're seeing organizations that are hiring nurses to run patient-facing podcasts, which are very interesting and I think a great way to leverage different types of communication styles for patient care. So I think there's definitely opportunities to really grow that visibility for nursing. And I hope that more nurses will take the opportunity to leverage their expertise in that way.
You mentioned a bit ago about some generational differences. What would you recommend to a nurse leader who's speaking or sending communications to multiple generations at the same time? How do you mitigate that gap?
Oh my goodness. Well, as nurses, we're very good at assessment. So I think the number one thing is just to really assess your work environment. And what I mean by that is, if you're leading multiple people and you have the privilege to lead multiple people, taking the opportunity to data gather, right? So we have so much data available at our fingertips. And I know like for health systems, the biggest payroll source is Kronos, right? So you have Kronos, you have access to people's birthdays. You can easily use that to determine like what percentages of different generations are in your area that you're supporting, and then you can go and look online. It's very easy to figure out and to find information about how different generations like to communicate, right? So some generations like that face-to-face communication. Some generations like, send me a short 30-second snippet. Some like a very formal email. And not to say that you have to tailor your every single communication to the benefit of every generation. Some of us do have to, conform. We can't expect that. But some of your bigger things that you're really looking to have and incite change around, any kind of change initiatives, you probably do want to ensure that you are sharing those where it is applicable to the receiver, right? So that they are getting the information in a way that they like to communicate. Maybe they need to read it in the email and they need to have it there so they can come back to it, or they like to print it out. Maybe they just want to be able to, you to give a 30-second video clip. So just making sure that you leverage your data to your benefit, right? Like if you have a group of 70% millennials on your unit, they're probably not reading your email. So that probably isn't the way that you're going to get them to, change a practice. So just making sure that you really leverage the tools that you have on hand to create opportunities to change your communication style if you need to.
That's great. There's an opportunity to be very strategic and intentional. And a lot of the responses you're giving, that's very clear. Whether you're hiring someone to help you communicate, whether you're posting your profile on LinkedIn or creating your brand, all that can be thought out and really thoughtfully prepared.
Absolutely.
I want to switch gears a little bit and talk about all the information that's available, all the chatter on social media. And it's hard for, I think, all nurses and non-nurses to discern what's real and trusted, especially with all the AI out there, and what's not. Maybe you could talk about that and which competencies relate to that.
Absolutely. So I think, when we think about nursing as a profession, we are the most trusted because we are the most ethical, right? Like we are very, that's just part of who we are. When we're in school, we talk about being ethical. We talk about, if you make an error, you own it, right? So you own up to anything that's going on. And I think when we're looking at discerning misinformation, when we're looking at what we're sharing, when we're looking at how we're appraising information, I think it's just like everything we do, from our first clinical to, the highest level of leadership and responsibility. I think you have to start with, assessing like, okay, I'm going to share this. Did I look at the sources? Did I double check? Or am I just resharing something that someone else has shared? Because I think intently, when people see, I know this person, they're a nurse practitioner, they trust what you're sharing. They trust that information has been vetted, right? So that's, just unfortunate and fortunate part of your title that you've shared that you're a nurse. So I think we do have an ethical responsibility to really employ our code of ethics and to make sure that when we are engaging in digital spaces, if we're going to share something, that we are vetting what we're sharing, that we're, doing our own discernment to assess that information. I think if you're, of course, I love AI. And I think when you ask the question about, determining what's AI, what's not AI, I think that's, something that your eye will gauge over time as you engage with AI more. I think if you're sharing something that has or is AI, there's all types of disclosures that you can place. If you're just rewording something, okay, just make sure you review it. But if you're completely having something written or generated, disclosing that that's where it came from, I think disclosure is a big piece of it, a big piece of our ethical responsibility, especially in presentations, just to share, like if I generate an AI image, I always say, generated by, and the platform that I used, and then I include the prompt, or I'll put the prompt in the notes if it's too long. But just so it may not be able to be replicated exactly, but, it's there. The information is there and it's transparently shared. So I think being able to do that is a great way to show that, we're continuing to have trust at the center of what we do and how we practice. And I think when you asked about the competencies that are part of that, I think ethical digital communication practices, of course, that competency, engagement and advocacy. I think as our responsibilities, when I first was thinking about the digital communication competencies, I think advocacy always federal, right? But it's so much more than that. It's everything we do. It's, if we're teachers and professors, we're advocating for our students and their needs and their accessibility. When we're nurses, clinically, we're advocating for our patients, or we're advocating for resources or various types of things, just depending what our practice setting is. So I think there's a lot of ways that you can leverage our digital tools and a lot of things that you can gather in the digital space to be able to help you, be able to accomplish both of those things, right? So to lead ethically and to communicate ethically, to share information ethically, to engage and to advocate. There are multiple ways to, kind of do your own double check. We triple check our meds. So we should also triple check the things that we are distributing and sharing online.
Yes, I agree 100% that we should check things that we're posting. It's our ethical responsibility, and trust in your nurse leader is so important. I also want to ask you, in your article, ethics landed at the top of the competencies. Were you surprised by that?
No, I wasn't surprised at all. I think when we think about our profession as a whole, we know that that's what we pride ourselves on, right? We pride ourselves on being trustworthy, on being ethical, on doing the right thing the first time. So I'm always honored to see patients and share that I'm a nurse and I'm a nurse practitioner. And I think they can feel that trust, right, when you engage with them. And I think that's what I expect when I share things online, that like my friends and my family, or, people from my kids' school who don't know me, but they know that I'm a nurse. When I share things, that's what I expect. I expect that they read that and they think, oh, she's a nurse. Like, I can trust that she shared that in good conscience, right? Vetted it and shared it. So I think that's what I think when I saw that it was, pretty high ranking. I was like, of course, because we're nurses.
Yeah. Well, thanks.
Of course.
So far, we've just touched the surface on your 9 competencies, and we're not going to go into all of them. So we definitely encourage our viewers, our listeners, to go to the link and take a look at your whole article. So tell me, Alysia, what are the next steps with your research?
Oh my goodness. So I think the next steps are going to be, how do we identify and determine the behaviors that nurse leaders need to actually fulfill the competencies, right? Like, how do you determine that you are competent when it comes to the digital communication competencies? So that'll be coming next year. So currently in process of working on how we're going to identify the behaviors for these various different studies. And what I really hope for that is that it will give leaders who maybe aren't so comfortable in that space a place to grow from, a place to start from, to say like, okay, I can do this item, but also give people who are comfortable in those spaces the opportunity to maybe build content, right? Maybe share content that specifically helps nurse leaders to be able to engage, to be able to develop that specific competency and that specific skill.
Perfect segue to the next question, because I'm wondering if you can recommend one action that all nurse leaders listening today can take to improve their digital communication skills, what would it be?
I guess it's to have presence, right? To have a LinkedIn account.
Start there.
Absolutely.
Right.
Yeah. I think if there was one thing that I would actually share is, if you're not sure, if you don't know where to start, phone a friend. So for 100%, all of us have someone who is present online to some capacity. So if you're not sure where to start, I would definitely start with phone a friend. The nursing community is big but small. I hope that makes sense. So there's always someone who I think is willing to help you. So I would definitely say, leverage the ask. So ask your network, whatever that looks like for you. If it's your group chat, definitely ask them. But the second thing is definitely you should be present. So if you're one of those people that don't have any presence online, I definitely get my headshot updated, or take a selfie, one that you're comfortable with posting online, and upload it, and at least give someone the opportunity to find you and connect with you.
Not an AI generated image of yourself.
I mean, I think to each their own, as long as when you show up, it resembles who you are.
And one question that we do ask all of our guests here on Nursing Insights is what you do for your own self-care. Self-care is such an important topic that we like to sort of embed it in all of our episodes. So can you tell us maybe one thing that you like to do for your own self-care?
Yes. So if you ever follow me on Facebook, you will catch me at Disney World. So catch me 2 weeks. Week of Christmas. I'm going to braise the crazy. So that is what I do. I'm there with my kids. But in all seriousness, I do leverage very much so the digital communication and boundaries competency for nurse leaders. So a lot of my posts are pre-scheduled, or I reshare them and schedule them. So if you see me active online at 10 p.m., that's probably something that was shared and I selected the wrong PM instead of AM.
Time management is crucial. So that's great advice. And we can use the digital tools to help us with that.
Absolutely.
Well, you were posting for those working nights.
Absolutely. We're going to say that.
Alysia, this has been fantastic, actionable advice. We appreciate you so much for sharing with us and coming on our podcast. It's truly inspiring work, and we can't wait to hear more. To all the nurses and nurse leaders listening, stay tuned to learn more about her work as we see what behaviors are being connected to the competencies and what that all looks like. So join us next time for another important conversation. Until then, stay safe.